Well, I want to just firstly say thank you very much for having me. Thank you to APNA, to Karen, to the whole board. I am really, really grateful for the support. I would like to give a giant shout out as well to Rosie. I think anyone who's had anything to do with the conference knows how hard working she is, and the whole APNA staff as well, so thank you very much. I would like to thank everyone in this room as well, because it was a big night last night. I was there, I saw the capes, I saw the champagne, so thank you for making it for the morning sessions. My name's Robbie Bedbrook. I'm a registered nurse from Sydney, Australia. That was a really nice bio and rundown of who I am, but more accurately, I'm a textbook Scorpio who holds terrible grudges, talks too much, and is really scared of birds, so good and bad qualities. Just to get started, I would like to acknowledge the traditional custodians of the land, which in Brisbane is the Turrbal people, and pay my respects to elders past and present, any emerging leaders, and anyone who identifies as Aboriginal and Torres Strait Islander in the audience. And I want to do that by sharing this quote from Dr. Tamara McKean, who is a leader in Indigenous health, and she was president of the Australian Aboriginal Doctors Association. And the quote is, "To us, health is about so much more than simply not getting sick. It's about getting a balance between physical, mental, emotional, cultural, and spiritual health. Health and healing are interwoven, which means that one can't be separated from the other." I think it's a really beautiful quote, a really powerful sentiment, something that we can all learn from, and something that I think nurses do fairly well in trying to bring holistic care to everybody. Here's a really brief rundown of what I'm going to try to talk to you about today. The reason that I chose such an unflattering photo of myself is because I looked at how many things I wanted to talk about in the time that I had and sort of wore this expression for about a week as I tried to cram it in. So wrap me up if I go a bit too much. I'm going to start with I'm going to take a message out of Holly Ransom's book, if everyone saw her speech yesterday, and I'm going to start with why. I'm going to talk to you about 3 areas that I'm really, really passionate about, which are health literacy, social media and technology, and nursing representation in the media. And that's going to give you a background and the why to who I am, what I do, and why I care so much about primary healthcare nursing. It looks like a lot. I actually really only have 3 goals today, which are to hopefully start to change people's thinking about social media and to show you that it can be an ally in healthcare, to demonstrate that we need better and more accurate representation in the media as nurses, and then hopefully to empower each and every nurse in this room to try to start finding ways to innovate in your own practice and the work that you do. If you have ever watched Game of Thrones, this should be funny, and if you haven't, you'll have no idea what this slide means. I promise it's hilarious. So, I would like to preface this talk by saying that I do not pretend to be the be-all and end-all expert in social media or anything, really. What I'm going to talk to you about today is from the work that I've done, the experience that I have had, and the research that I've looked into. But I still recognize that there is a lot that I have to learn and a lot that I can still learn. But on that note, I want the fact that I am standing here today to be a message to each and every single nurse in this room. I think nurses often have their voices overshadowed by other people who are working in the world of health. I'm not going to point to any professions in particular, doctors. And more than that, I think we're starting to live in a really highly specialized world where it can feel like you need a million credentials just to talk on one subject with authority. And that can make it feel like your opinion is a little less valid than everybody else's. But I don't have a master's, I don't have a PhD. I graduated less than 3 years ago, but I have a voice and I really believe that I can have impact with it. And I think what's important for every nurse to remember is that it doesn't matter who you are or what your role is, whether you're an RN, a CNC, a CNS, an EN, an educator, a student, you are actually already an expert on something. You're an expert on delivering care, you're an expert on empathy. I'm sure there are a lot of people in this room who are actually experts in the field that they work in, and you should never have that belittled because you're a nurse by anybody. And if I deliver this talk correctly, hopefully you will want to leave here today being a mini expert in innovation as well. So I will start with my why. I want to talk to you a little bit very briefly about health literacy. I chose this photo because I think this very accurately represents a lot of consults that we will see with people where someone will just bombard them with information and it sounds like absolute gibberish and then they leave having absolutely no idea what's going on. Health literacy to me is basically about our ability to understand information that relates to our health and then to be able to use that information to make decisions that impact and affect our health. And the Australian Commission for Safety and Quality in Healthcare estimates that about 60% of Australians have low individual health literacy, which isn't a new phenomenon. We have had demonstrably low rates of health literacy in the past, and it's actually quite common across a lot of Western nations as well. When I first sort of engaged with this statistic, I was quite surprised because I thought, but we've got such a great healthcare system in Australia, we have such great education in Australia, I really thought that we would have better rates than that. And then I started to think about patients that I see every single day at work. You know, you'll call somebody into the treatment room for a B12 shot, and you'll go, okay, do you know what vitamin B12 is? And they go, nah, I just know I need it. And you're like, oh, okay. And then you do a medication review with someone, you're like, all right, John, tell me what pills you take. And John says, oh, well, I take the 2 little white ones in the morning, there's the gel cap at lunch, and you go, okay, names and doses? Nah, just pop them out of the pack and take them. Okay. You see people who don't know what STI check they should get based on who they're sleeping with. You see people who don't understand what bulk billing is and don't understand why gap payments are increasing. And so when I really started to think about how broad health is, how many areas that it touches, and the people that I see every day and the questions they ask me, this statistic sort of started not to surprise me as much. Another facet of my why is social media, the new normal, the new world that we live in. I just want to share some somewhat sobering statistics. 60% of Australians use Facebook. 50% of Australians will watch at least one YouTube video every day, which means that half of us in this room either have or are going to watch some kind of cute cat video later today. Guilty. A third of us use Instagram. Globally, over 2 billion people use Facebook. 81% of Australians own a smartphone. Almost all Australians have access to some kind of internet-enabled device. And what I think is really important is that 90% of what we do with our mobile phones, with our smartphones, isn't actually make calls or send text messages. It's use apps and engage with social media. And I don't share that because I think that social media is the absolute best thing in the world and that we should all get on it and it has absolutely no consequences. Woo! No, definitely not. I share this to show that social media is not a trend. It's not going anywhere. It's the world that we currently live in. And more importantly, just statistically, our patients are engaging with social media. This is a real way that they communicate with the world and with each other. And so I think that we as nurses should view social media, if anything, just as an opportunity. It is a new way to reach people. It's a new way to educate people. And if we don't take up this opportunity, if the horse sort of leaves the stable and we are not on it, then the only way that we can really view social media is as a missed opportunity. What we're seeing with the increase of social media, of course, is also the increase in Dr. Google. Has anybody ever had a patient come in who's Googled their own symptoms or health information? Yeah, maybe even come in with printed out information, things highlighted. Yeah, of course, this is what I have. And you're like, oh, okay. I absolutely need this mug. I'm sure everybody in this room does as well. Very staggering statistics. 1 in 20 Google searches are for health-related information. 1 in 20 things that people will search for are about their health. 20% of patients will look on Facebook for health information. And most staggering, 80% of people aged 18 to 34 will actually try to use Google to avoid engaging in primary health care, avoid seeing the doctor. And this statistic is so staggering because we know that in order to have good long-term health, you want to set habits early that are good, and one of those is engaging in primary health care. So all of this looks quite alarming. Social media is going up, Dr. Google is going up. What does it mean for health? What does it mean for life? Thankfully, the impact as it stands right now, there is still a lot of research to be done, is fairly neutral. And the research consensus is basically that social media are not a problem, but the way that we use social media can be a problem. And it can very much have excellent benefits and some really negative consequences as well. So just a couple of examples to share. That's how good I am at technology. I even use this funny button. Alison Fairley, I don't know if anyone knows her, very, very amazing woman who used social media and a blog to advocate for mental health in rural and remote areas. Very, very impressive human being, and really used social media to create a positive impact. I can't think of a better example of social media creating positive cultural change than the recent Me Too movement, which is a movement against sexual assault and harassment, especially in the workplace. And social media basically acted as a whisper network on steroids to show people the breadth of this issue, and we've seen real, amazing, positive cultural change as a result. But then, of course, there are negatives as well. It can be something as minor as the phenomenon known as text neck, which is that the way that we all use our smartphones is actually starting to create a bit of damage to our neck and our postures, and you can see that in some people in the way they walk with them. It can be as small as that, or it can be as massive as the spread of misinformation. So during the Ebola outbreak, somebody actually tweeted that drinking salt water would cure Ebola. I know. Which, unfortunately, people saw, took up, and it did make some people really, really sick. So I think just looking at this, we can just see that it can do good things and it can do bad things. Social media is just a tool. It's just a resource like any other that we use in health, which can have positive and negative consequences. Some pain medications are phenomenal for relieving pain, and then they can also lead to addiction. Some steroid treatments are amazing for respiratory conditions, but they can have devastating effects on our skin and our bones with overuse. I just think basically we should look at this and think, all right, our job description should shift a little bit so that even if we don't regularly use social media, we just understand it and we know how to talk to our patients about it to make sure that we see more things on this side as opposed to this side. And the last why that I want to talk to you about is nursing representation in the media, or rather lack of nursing representation in the media. As a nurse, have you ever been watching any kind of medical drama on television and just gritting your teeth and rolling your eyes? It is infuriating because you're likely not seeing a nurse on the screen, or if you are, they're like fuzzy in the background and they're just like drinking coffee and gossiping and like having a great time. And I think you can have shows like Grey's Anatomy and House where over 20 lead characters are doctors or physicians, and there is not a single lead character who is a nurse. Ratio-wise, this doesn't make any sense because we represent the greatest number of people in the workforce when it comes to health. And then even if you do see a nurse in these shows, the only nurse character I can remember gave everybody syphilis. And I mean, thank God for Grey's Anatomy. This is the worst example because I didn't realize that my surgeon would answer my buzzer. I didn't realize my surgeon would counsel me at the bedside and provide medication reviews and mobilize me to the bathroom and do my wound care. I mean, thank goodness, because I'm going to ask a lot more when I go to the hospital now if I ever need a surgery. And these aren't the only examples. Things like the Mindy Project, House, Grey's Anatomy, Scrubs, All Saints was a very popular drama, and that did have a lead character who was a nurse, which was very matronly, two-dimensional, no nonsense, and again, it was only one. And then again, and of course I'm not talking about Jean Kitson's role as a nurse. That was, I'm sure, very accurate representation of nursing. And then of course, when you do have a lead character who's a nurse, it's Nurse Jackie. Has anyone ever watched this show? Yeah, great show, hilarious, except very overly sexualized. She was addicted to opioid medication. She spent the whole first season cheating on her husband with the pharmacist. I mean, an amazing three-dimensional human, but I don't work with many Nurse Jackies. I pray I'm not a Nurse Jackie. Don't look too closely into my social media. But do you see what I mean? We're not represented here. And the message is very clear. If you don't see yourself being represented, the message is that you don't matter. And you see it all the time with minority groups. If you're watching a drama, anything on TV or the movies, and there's no characters of colour, what message does that send? That you don't exist in the real world? No diverse genders, no diverse sexualities. It's the same thing here. If you don't see yourself being represented in what everybody is engaging with, the message is that you don't matter, and that is rubbish because nurses do matter. We are fundamental to a healthcare system that works and has positive patient outcomes, and we absolutely need to strive for better and more accurate and more numerous representation in the media. All right, rant over. How am I doing? Yeah, I'm all right. So very early on when I started working full-time, I sort of looked at these three issues and I really wanted to do something about them. I saw patients with poor health literacy. I just saw the increase in social media and how I use it, my peers use it, my patients use it. And since the dawn of time, I've known that nurses are poorly represented in the media. I thought I really want to make an impact in these three areas. But God, I'm lazy, and I really don't want to do three separate projects and initiatives on this. How can I improve health literacy and nursing representation using social media? Can I do that? Hopefully the answer to that was yes, and I tried to do it with an initiative called Hot on Health. Hot on Health is something I created about 1.5 years ago, and it's very simple. It is a tool for health promotion where I use videos, articles, and social media to share evidence-based information. Basically, what it looks like is that I'll come up with some kind of health topic. I'll make a video on that, really simple, easy to understand video. I will share that via social media. I'll pair that video with a more formal article that I write. And with that article, I will share all of the evidence and the research and the resources that I use to create that content. And so the idea is to bridge knowledge gaps with common health issues, promote primary healthcare and get people to see what we can do and see what you could be doing with primary healthcare, and also to have a bit of better representation and to create a bit of a cultural shift as well. I think a lot of people see health as something you only need to engage in when you're sick, but by seeing it regularly, constantly in your newsfeed, the idea is that health is something ongoing. Maybe this is something I should be thinking about a lot. Maybe it actually has impact on my identity. I mean, if it works for the Kardashians, surely it's going to work for health, right? So what does Hot on Health look like? If I didn't talk so much, I could probably show you one of these videos, but as you can tell, loves a chat, running out of time. So I thought I'd just show you stills of what it looks like. Anyone who works in general practice knows that it's very varied. The topics that you tackle are quite diverse. And so I've made videos on acne and acne treatments, getting the flu vaccine. Oh my God, I think I've done about 2,000 flu vaccines in the past 2 weeks. Building a first aid kit, how to access a mental health care plan if you're eligible, wound care, explaining bulk billing and our healthcare system. What is it? Why should you care? Why does it matter? I do a lot of work in sexual health, so a lot of my content is about sexual health. I've gone onto the streets and asked people what they think about health, what they think about nursing, to try to get them involved. And it's all just information that's very simple and very easy to understand. And looking at all of these stills, there is something that every piece of content I try to produce has in common. The first is that they are bright, fun, colourful, modern, and hopefully engaging. Because, again, stealing from Holly Ransom, people are much better at engaging with visual content these days than they are something that's written, so it needs to be kind of bright and engaging. But more than that, I think what we've learned from public health campaigns is that you have to be able to entertain people as well as educate them, because there is so much content online and it is incredibly competitive. And if you are not doing your best to entertain someone as well as inform them, they're not going to watch. They're going to click onto something else. There are 5 million cute cats rolling around on a carpet that demand my attention over this public health campaign. And so I'm trying to shift that a little bit. Each video, it tries to engage people or get people to engage with primary healthcare. It's not just like, here's a video, solved your health issue, don't come in. It's, here's something that we can do for you in primary healthcare. Did you know that? No, come through the door. All the information is really easy to understand. I don't use jargon at all. And that kind of links to health literacy because it's about understanding how people are searching for information online. People are not using technical terminology. There's a really brilliant study or paper that was done called "My Vagina Makes Funny Sounds." And it was a quote that was taken from something that people put into Google. Because you're more likely, if you type in "help it hurts when I pee" instead of the word chlamydia, you're not going to get evidence-based information. You're going to get some Yahoo Answers or blog that is not based in any evidence. And so we working in health sort of need to understand the terminology and the language people are using now online and then engage with that. And then very evidently, the last thing that each piece of content has in common is me, Nurse Robbie. And this was a very conscious choice. The name is not just a marketing gimmick. I basically, by using that name over and over and over again, I just wanted to show people that all of the content that you're looking at was researched, put together, and presented by a nurse. Because nurses are hardworking, intelligent, compassionate. We base our care in empathy and science. I really just wanted to demonstrate to people that there is so much more to our scope and to our role than you probably think there is, because you haven't seen it represented in the media. But there is so much that we can do. And I really just wanted to advocate for nursing because it's a wonderful job, and it's a job that's often overshadowed. And we do really challenging work for not very much money and not the same status that a lot of other roles get. And aside from teaching the general public that, I really just wanted to empower everybody else who is a nurse as well to be like, you're a badass. You're amazing. And the work you do is important and can have a really broad impact. And more than just advocating for nursing, I wanted to advocate for primary healthcare nursing, because if nursing is pushed out of the spotlight, then primary healthcare nursing is even more pushed out of the spotlight, and I feel like it's our turn for a bit of representation. If you haven't seen Black Swan, this also won't make any sense to you, but I promise also hilarious. So there was the recent report from APNA that showed that primary healthcare nursing is often viewed as a bit of a step down when compared to other fields of nursing. Something you do if you're gearing up for retirement or coming back from injury leave, or not something that you would want to do. Which anybody who works to within their full scope in primary healthcare knows that's absolutely rubbish. It is incredibly challenging work. It really pushes you to the breadth of your scope, and you can have major impact. I will very briefly share, oh yeah, I'm doing great. I'll very briefly share an anecdote with you. I recently saw a patient at work who was an educator, or is an educator, at a hospital near the clinic that I work in. Called him in, and it was just one of those days. You know what I mean? You look at, and there's about 4 people still waiting when you call them in. You call them in, you know this consult's going to take about 20 minutes. The phone is ringing off the hook. People are like bursting in the door, being like, where are the vaccines? It was just absolutely nuts. And I was doing an IV iron infusion for this patient, which requires a bit of upskilling. It's something that only used to be able to be done in a hospital setting, and now we can do it in a clinical setting. It's a fairly involved treatment. At the end of this whole process, in this crazy day, he stands up and goes, wow, it must be so great to work somewhere so chilled out. How do you not get bored here? Oh, infuriating. What the walls of my treatment room here, nobody else needs to, the words I say. But I think that's quite common, and I did share that story on social media, and people sort of wrote back, and it's very common, and we really need to try to shift that narrative. And more than it being common, it's also quite disheartening, because I think the best thing I love about doing Hot on Health and trying to represent nursing is that I've had a lot of university students reach out to me who have basically said, thank you for someone standing up and being like, I don't like hospitals. I don't think I can do my best work in hospitals. I didn't like my hospital placements at uni, and I love working in the community. Because I think anyone who works in universities know that there is still a bit of a narrative that if you want to really get skilled, if you want to really be a real nurse, you have to work in the hospital first. And it's disheartening that there are people in the world of health who still think that, because it means that we're losing bright, vibrant new grads who could bring a real amazing energy and enthusiasm to the role. Now just completely pivoting to a slightly different topic. One of the reasons I love primary healthcare nursing so much is because I also love innovation and I love positive change. And I've always thought that nursing is the perfect position to be an innovator because nurses sit right in the middle of healthcare. You see everything because you're liaising with doctors, allied health, patients, administration, and so you see all the different modes of delivery of care and you see where they are not working. And that means by seeing that, you know how to make change. And I think that is especially true of primary healthcare, because as opposed to needing to overhaul a whole hospital system or a whole health district, every clinic that we work in is a unique ecosystem. And so you just need to change the practice that you're in, the practice that you do. And I'm not saying that's easy because we all work with some very, very stubborn people where it's very, very hard to make changes, but it is really, really possible. And I want to share with you a few examples from the clinic that I work in, because they don't need to be as massive as Hot on Health. You don't need to sort of start a video channel. Please don't. I don't need the competition. But there are ways that you can innovate and make changes in seemingly small ways that can have broad impact. So 2 of the things that we do, I do, as I said, a lot of sexual health work, and we work with patients who often use hookup apps, which are basically apps you download, geolocate, and et cetera. Didn't think I'd get shy in front of a room full of nurses. And so basically, you can advertise on these apps. And so people advertise awful things like laser hair removal and just like really exploitative. And the clinic I work at thought, well, why not advertise STI testing at our clinic? Which we did. The click rate on the ad is phenomenal, and the retention of people keeping those appointments is also phenomenal. And that means that you know that a really high-risk demographic is engaging in testing and treatment. Recently, the Gardasil vaccine became funded for any gay or bisexual man under 35, and so we pushed to get that advertised, which we did as well, and I've done about 200 Gardasil vaccines in the past 2 months. And you know that this population who's at risk is now immunised against HPV. Very small change, very big impact. I also work with a demographic where there's a really staggering epidemic in crystal meth and ice use, and we as a clinic, we wanted to bring up those conversations with patients, but we didn't know how to do that because talking about drug use can be really difficult. And so with the approval of my clinic, a very small change, I updated my pre-vaccination checklist at work with one simple question, which was, in the past month, have you used any recreational drug? Very passive, very simple change. I can justify it by saying if the answer is yes, I'll check your hepatitis status, maybe give you a Hep B vaccine. But actually what it is it's just creating a safe space. Because people who are struggling with addiction or drug use desperately want to talk about it, the research shows that, but feel a lot of shame and a lot of judgment and probably won't bring it up themselves. And in this way, if they tick yes, they know that the nursing station is a space that is free of judgment. You can have these conversations, and I've had some really beautiful conversations with people, and nurses are often the people, at least in the world of crystal meth, who will do the most referrals to specialist services. If you want to look at innovation, simply look around this room, because this conference is basically a showcase of innovation. The abstract sessions, the workshops, everything. You are all people doing amazing things in your clinics already, and you can learn so much from each other. So I really encourage you to talk and have a couple of conversations. If you see something really cool, grab that person, try to tweak it and figure out how you can use it for your clinic. A really simple way to innovate your practice is to start using social media for patient education, which sounds very daunting, but it can be as simple as having a whole bunch of really good, credible websites bookmarked where you get your information from. CDC for travel health, Better Health Channel Victoria for every health topic under the sun, and then share those with patients. Start downloading the apps that health organisations are creating. The Kidney Australia, Diabetes Australia, Heart Foundation, they have apps. Download them, enter fake data, just play around with them, figure them out, and then share that with your patients. I could talk about using social media for patient education for a million years, but I don't have the time. But what a brilliant segue. Thanks, Jane. To talk about that, I am doing another talk this afternoon. It's a panel discussion about growing your career in primary healthcare at 1:30. It's one of the concurrent sessions. So it's actually a whole panel and workshop about just how to expand your career in primary health in many different ways. But I will be sharing some tips for nurses, practice managers, students, whoever, about how to use technology and social media to expand your career in lots of different ways, whether that's patient education, job hunting, increasing your scope of practice, doing research, networking, whatever it is. It's a really bold list of things that I've given myself to talk to you about just there. So if you do want to get connected, this is who I am. I always say that I don't have business cards because I'm environmentally friendly. It might also be because I'm a little bit lazy. But please do take a photo of this if you want to connect in any way. I've become a little bit of a yes man in the past year where I just sort of say yes to everything. So if there's anything you ever want to talk about, bounce off of, please do get in touch. Please follow me on social media. The probably simplest way to contact me is through the website. And then there's a little contact tab, and that'll go directly to my email address. I'm very open to collaborating and trying to help every practice innovate, because as I've said, I think primary healthcare nurses are going to be the people who revolutionize and change the healthcare system. And if I can have some small impact in helping you do that, I would be very grateful. Please also do watch the videos. I love constructive criticism, so if I've said something horrendously inaccurate, please let me know. So that's pretty much it. I want to end by saying Happy International Nurses Day. I am very proud to be a nurse. I hope everybody in this room is very proud to be a nurse as well, because you do phenomenal, incredible, amazing work. Please don't ever let anybody belittle your voice because you're a nurse, because it's really powerful. It can have really major impact. Primary healthcare is absolutely the future of healthcare as people are getting pushed out of the hospital to be managed in the community, and you're going to be the frontline leaders in that. Again, just a massive thank you to APNA for having me. I can't remember if I swore or not, and I apologize if I did. And just because I didn't put them in the slides, because I didn't want to ruin the look of it, these are all my references in case you think I'm talking bull. But that's it. Thank you very much.